So they always ask, like, what's the difference between heartburn and GERD? So the thing is that the difference is like, okay, is this happening once in a while, or is this happening in a chronic fashion that's happening repeatedly? So chronic heartburn may be a sign of gastroesophageal reflux disease, or abbreviated, the acronym is GERD. So gastroesophageal, again, stomach, esophagus, and reflux, that's bubbling up of stomach acid into the esophagus. So this is compared to acid indigestion. Instead of being a one-time or occasional thing, this is a chronic thing for patients with GERD. So it's chronic acid reflux versus a temporary acid reflux from maybe eating too much pork adobo with too much vinegar, or eating too much or Taco Tuesday, or eating too much salsa. So again, or pico de gallo. So the gastric acid leaks past the lower esophageal sphincter, and again, this is going to bubble up. So that very acidic gastric acid is now bubbling up into the esophagus. So many multiple potential causes. Do I want you to memorize the causes? No, because many things can cause GERD. So things like being pregnant, being obese, fatty meals, medications, lots of them can cause that. I know Taco Tuesday. I know I'm like Cardi. Like, did you see that video of like I should be in a restaurant eating sushi, not cereal? Sometimes I feel like that with the lockdown. I know we're all going crazy in our houses. But anyway, so this can lead to further diseases. So again, things like ulcers. So this is a normal esophagus. This is an esophagus with all these nasty, nasty ulcers. Why? Again, if you have that stomach acid eating away at the epithelium of your esophagus, this is going to cause a lot of these sore ulcers. So ulcers, esophageal strictures. So the esophageal stricture, what's a stricture in general? So your esophagus is very flexible, and again, why? It needs to do that peristalsis. But if you have your esophagus being beat up by GERD and stomach acid so on a frequent basis, it's actually going to start to narrow. Why? Again, one of the things that can cause your esophagus to narrow and become less flexible is something we call fibrosis. You remember fibrosis, it involves the deposition of collagen. Collagen, again, is like the duct tape of your body. It's very good at holding things together, but it's not very flexible. I mean, duct tape is flexible, but it's like steel cables. It's more like steel cables. Why? It's used to patch things up. So but at the same time, is as functional as the original tissue? Not really. Barrett's esophagus. So the weird thing about this, like, what can happen if you keep on eating away if your stomach acid keeps eating away at the lining of your esophagus, it can actually start to take on the histological level, the tissue level. It can actually start looking like more like your intestines and your stomach epithelial tissue, and it's very and that can also predispose someone to esophageal cancer. So things that you want to keep your esophagus, even though, yeah, some people just think of it as a tube that connects your pharynx to your stomach. If it has all this, if you beat it up with ulcers and all this gastric acid, it can lead to this esophageal cancer. So again, GERD is chronic versus just acute or occasional, like acid indigestion. So this is why sometimes if you think if a patient has GERD, you want to monitor their pH of their esophagus to make sure, like, hey, it's not chronically acidic. And you also might want to look in it as well to make sure that they don't have all these ulcers forming. So what can you take for GERD? So you can take something like Tums, but again, are you going to have Tums all the time? So what you can take for GERD is, hey, this now familiar drug, right? So again, it treats peptic ulcers, but now you're wanting to prevent esophageal ulcers, right? So maybe you're going to take something that prevents ulcers. So omeprazole is also something given for GERD, and I don't know if dogs can take it. I mean, dogs have they have different metabolisms than or a different set of metabolic enzymes than us. So I wouldn't suggest giving it to your dog. But I mean, who knows? Check with your vet. Sometimes there are overlaps, like you can give the same drug, but again, don't do it without vet's advice. Again, they're going to know more about animal physiology and pharmacology than we do. All right, so proton pump inhibitors, again, block the proton pump. You're not going to get acidic acid being released by parietal cells into your gastric acid and stomach content, so your gastric acid is going to drop in acidity. It's going to have less hydrogen ions. Therefore, you're not going to have that bubbling up. If your stomach contents does reflux and bubble up, this is why you're able to use omeprazole to prevent ulcers. All right. Oh, great. I'm glad he was able to get some medicine. All right, so you have duodenum and the pancreatic duct. Again, you have your stomach up here, out of view. So the pyloric sphincter opens, releasing the chyme into the duodenum. Now this pancreatic duct, again, we didn't really get to cover the accessory digestive organs, but this is also another important, again, remember the pancreas is very important for one, producing insulin and glucagon, two, also important in producing all or enzymes that can digest all four types of biological macromolecules. Again, the pancreas secretes amylases, lipases, proteases, and nucleases. But the pancreatic duct also secretes an important chemical. So we have the pancreatic duct accessory and the main one. So the thing is that the pancreatic duct cells, what am I getting at here? So again, you have pancreatic juice. So the pancreatic duct cells, they also secrete bicarbonate as well. So pancreatic juice ranges in pH around 7.5 to 8, so it is basic. So the pancreatic duct cells, they produce all the enzymes, they produce hormones in the bloodstream, but they also produce a lot of bicarbonate. So why? So again, bicarbonate can neutralize acid. So say you have the duodenum, again, all that chyme coming from the stomach, that super acidic mixture of food and water and acid. So you have the mucus in the duodenum as well, but now you have a squirt of pancreatic juice that not only has those enzymes, it also has a lot of bicarbonate ions as well. So you have all these bicarbonate ions. This is going to neutralize that very acidic chyme. And this is how you're able to go from that very acidic mixture of food and acid called chyme and neutralize it so that the insides of your intestines aren't as acidic as your gastric acid. Right, so again, saliva, gastric acid, and duodenum. So hydrochloric acid is being neutralized at both ends by the secretion of bicarbonate by the pancreas, and also your epithelial cells, as well as bicarbonate being produced in your saliva. So again, this is how you keep acid in place chemically. And again, remember those esophageal sphincter, gastroesophageal sphincters, and pyloric sphincter. So you have both chemical and physical ways of keeping stomach acid in place. All right, so actually, I think I'll stop lecture. We're actually done early. I could have included more, but I think you have a lot on your plate. So I will check